Hello, dear fish keeper, or fish breeder, or businessman dealing with fish. Because you're watching my videos, that means you want to learn to understand fish diseases, how to diagnose, maybe how to prevent, but especially how to treat. Everybody is looking for a solution or the perfect medication to take proper care of the sick fish. Well, in this case that you selected to watch, I will talk about the killifish, the Aphyosemion australe, and I'll show you my PowerPoint that gives you the idea, or at least the pictures, what's happening with this Aphyosemion australe hjersseni, which has a nematode worms infection called Capillaria. My books on fish diseases talks about prevention, diagnosis, and the use of correct medications. In the new illustrated guide, there's a separate chapter on killifish and what kind of problems they usually are suffering from and what you can do about it. Here, this Aphyosemion australe, you can see that the fish is clamping the fins, the tail is wasting away, becomes skinny, and we noticed that there were some losses recorded. So that's the only signs we could see. But when we checked the fish and we examined the organs, we found capillaria, worms, nematodes, which came out of the intestine by squeezing the sample I collected. But inside the intestine there was more capillaria, and here we see some of the eggs already getting loose and ready to distribute in the aquarium and reinfect, or a risk to reinfect other fish in the aquarium. That's the risk with capillaria, these eggs here. That you can find when you check excrements of the fish. Fresh excrements can tell you, wow, eggs of a capillaria, that means a risk of spreading to the other fish in the aquarium. Luckily, there's an easy disease to detect and a disease that you can treat. The fish becomes weak or big due to the worms, and there is a big risk that they get afterwards secondary bacterial infections. Look for the origin. Usually it's feeding live food or other infected fish that are in the tank. Treat with an anti-worm medication like praziquantel or other medications that I explain in my books on fish diseases, or ask your fish doctor or veterinarian. Meanwhile, you can help with a functional fish food that helps in the repair during this infection. And here we would recommend Dr. Bassleer Fish Food Pumpkin. My books tell you how to diagnose, how to prevent, and how to treat. I hope you can get one of my books, maybe in your language. And my Patreon channel gives training for those who want to learn more about keeping fish. Also, I have courses on aquariology. That means the basic knowledge about what to do with problems in an aquarium. Well, that was my explanation on this case of this killifish. I suspect the live food was the cause, that the fish has been fed with live food that had eggs of capillaria or worm larvae, possibly. Keep an eye on it and subscribe so you might learn more in my other videos that I have available on my YouTube channel. Thank you for watching.